That's the positional dysfunction that you're finding. How do I correct it with muscle energy technique? Just like this. I have to have up into extension. I'm going to, just for another contact, and I can control the head motion a little bit, do what's called a chin cradle. But I'll come in close. And as I bring her up into extension with the help of the chin cradle, only to the segment, remember that, I'm just going to impart a slight bit of side bending. No rotation here in OA for your localization, because we don't want to disturb any flow and patency of the arterial supply to the brain. Okay? Important. So all I need to do now, because we're working with small little muscles and we're localized, is have her do what with her eyes? Just look down. Look down and try to flex the head. Relax. Wait for my 3 seconds. A tiny bit more of extension and a little bit more of side bending. Okay? That side bending is being very well controlled through the use of my chin cradle grip. Resting on the chin, but you can see my forearm and the wrist is on the side of the zygomatic arch here. So I can take her into more side bending as I need to. But it's only slight. Okay? Again, I could now ask for some muscle contraction. Tuck your chin and try to side bend to the right. Hold. 2, 3, 4, 5. Relax. Extension, side bending left. Helping to get the left condyle to glide more anteriorly. Okay? Alright? So that's the correction for the flexed lesion. You remember my patient's name who had the flexed lesion?
David.
David. Very good.
Will that be on the test?
What?
Will that be on the test?
Extra credit.
Finger crossed.
If you can find David, you passed the class.
But on the question for the exam, you can set up the vignette or the scenario. Your patient David walks into the clinic. Gotcha. Your next patient David walks into the clinic, and he presents in a position of suboccipital flexion and side bending to the right. You set that vignette up because this is the way they're going to ask you questions on your PT exam. Then they'll ask you, what might be an assessment method you could use to check for his OA mobility? What condyle might be limited? What's the positional fault of the condyle? When you're using muscle energy technique, what are you trying to improve? What muscles may have been involved? A, B, C, or D, true or false? That's 5 questions out of a 50-question exam. You're a tenth of the way through your exam, just on the one case scenario. But that's how you want to. That's how you're going to develop your critical thinking. Develop case scenarios and work from there. And that's exactly how you're going to be asked on your exams. So that is going to be actually on page 211. Okay. So during our assessment, with a little bit of flexion and translation to the right, causing left side bend, I felt more restriction than when I had her in the flexion bias and translating her left. Actually, that is your true restriction. This one. So in Lindsay, she actually has that. She actually has limited motion in left side bending while she's in a flexed position. So if she's having trouble flexing and side bending left, which OA is a problem? The right one. And what is it not doing? It's not going posterior. Right? So we're going to correct that in the same way that we've corrected the other, but with a flexion bias. And for that, I'm going to actually stand up, because I like to always use my torso and belly to make a second contact. Right? The ride's for free. So again, we're going to use controlling for the side bending and the flexion with our chin cradle grip. So just rest on the chin, forearm comes along down the side, and if I want to, I can rest the top of the head, not with compression, just as a contact. So I flex up, side bend away, or side bend to the left, which means I'm rotating which direction? To the right. And I ask for her to do what? Look up with her eyes, or even with a little muscle contraction, just slightly extend your head. Relax. Further flex. Further side bend with localized translation. Notice her lower cervical spine is staying in line. It's not doing this. Okay? The translation is purely at OA. Again, look up, hold, 2, 3, 4, 5, relax. Further flexion, further side bending after the post-isometric relaxation. That's it. That's your treatment for little stuff. Let your head just drop down. Oh, there you go. Alright, so we reassess, and it's a little bit improvement, which is nice. So let's break up into groups. First, any questions?